The Kowalskis just won a $220 million lawsuit against Johns Hopkins All Children's Hospital, but it all began in 2016 when 10-year-old Maya Kowalski was rushed to Johns Hopkins in Florida with a crippling stomachache. Maya was diagnosed with complex regional pain syndrome.
I want to go through this case and explain how something like this can happen. You may or may not have heard of this story, but the gist of the story is that Maya Kowalski was a 10-year-old girl with a diagnosis of complex regional pain syndrome. That's a disorder that we don't fully understand, but is a dysfunction of the nervous system. Essentially, it can cause excruciating and crippling pain. I'm going to briefly explain the story and my thoughts on it. Maya was diagnosed with this condition and was initially treated with IV ketamine. It can really help individuals that are resistant to more traditional therapies. And in Maya's case, it was really helpful. Maya began to have severe debilitating pain, and her mom took her to Johns Hopkins Children's Hospital in hopes of getting some treatment. Specifically, her mom, Beata, asked the doctors to give her IV ketamine because she knew this treatment worked in the past. This is a really unusual treatment to most doctors that aren't familiar with chronic pain. They thought Beata was magnifying her daughter's symptoms and thought she had something called Munchausen by proxy, which is essentially where a caregiver or a parent can falsify symptoms in order to gain attention. It's a really big accusation. The hospital contacted Child Protective Services, and Maya was placed on hold in the hospital for over 90 days without being able to see her parents. Maya was in pain, and her mom was just trying to advocate for her child. When she felt like she wasn't gaining any ground, she took her own life. Just a few days after Beata's death, Maya was then reunited with her dad and her brother. So they sued Johns Hopkins for Beata's death, and they were found to be negligent on many causes. The Kowalskis won over $220 million. Now you may ask, how can this happen? You see, working with patients in pain, you have to be very understanding and make sure you know what's going on in their case, especially in patients with chronic pain disorders like CRPS. They don't necessarily have something that you can see to explain their pain. And just because you don't see it doesn't mean that they aren't experiencing it. All healthcare providers should be compassionate and try to understand patients that are in pain and not just make assumptions, because assumptions can often be very, very wrong. And in this case, you just had a mom that was trying to advocate for her child that was in pain, and it ended up costing her her life. And her family will never be the same. I really hope that this story will bring more awareness to CRPS and patients that experience chronic pain, because we are here as healthcare professionals to help treat people in chronic pain and not make judgments or assumptions about why they may be experiencing it. What are your thoughts on this case, and how can we learn from it? Leave your comments in the comments section. I'm anxious to hear what you guys think.